back. This is Get Wet 101. In today's live broadcast, we're going to be talking about Edema Part 4. We're doing this because of several people who have been unable to participate in our previous broadcast. And we have been getting a lot of email, a lot of text messages that they would have loved to be part of it. So we didn't put the video ads yet, so still working on it. But for the sake of those who have not been able to participate in any of our discussion as regard Edema, we will do another quick review and walk you through it. Okay, so if this is your first time, please kindly subscribe and like the video. This is Get Well 101. Okay, so we are talking about edema. I will say that edema is a swelling caused by extra fluid trapped in the body tissue. Okay, thank you so much for joining us. So it is an extra fluid trapped in the body tissue. Basically, when fluid leak out of the tiny blood vessel and build up under the skin, you get puffiness or swelling, and that is edema. So, like I said, this will be our last time we're dealing with this topic because we've worked on it several times. Okay, so the common place where edema happen in the body, the most common one would be your feet and your ankle. So if you notice a swelling in your feet and your ankle, it is due to extra fluid trapped in the body tissue. It is due to fluid leak out of a tiny blood vessels and build up under the skin. Okay, so please kindly subscribe to Get Well 101. Subscribe, like, and share. Subscribe, like, and share. Thank you so much. Okay, so the common places that you notice this in your body will be your feet and your ankle, your legs, your hands and your arm. Then if you your face, especially around your eyes. Okay, you carefully notice it in your face too, especially around your eyes. Okay, so you can also have a fluid buildup in your belly. That would be your abdomen. So you can also notice it in your abdomen. Okay, so what it looks like if you have this swelling in your body. So please kindly subscribe and share and like the videos. Kindly subscribe, please kindly subscribe. Okay, so if you notice this swelling, what does it look like? It will be a swollen or puffy skin. Okay, so skin may look stretched or shining. Edema, PT edema. If you press the swollen area with a finger, it leaves a dent for a few seconds. Feeling of heaviness, tightness, sometimes discomfort, and reduced movement. So common causes of edema will be edema can happen for many reasons, including one, mild to temporary causes. Okay, mild and temporary causes will be standing or sitting for too long. If you be in a position for too long, you may have a fluid buildup in your leg, but this is temporary and it eventually goes away when you elevate your legs. Eating too much salted food can also worsen edema. Pregnancy with the volume of blood and all that can also cause edema. But pregnancy edema should subside when you deliver. Hot weather is also a contributing factor to edema. So, what are the medical? Those are mild and temporary causes of edema. In other words, temporary in the sense that they will virtually go with time or with simple home remedy, eventually go away. But the medical causes require and require medical attention. So if your edema is caused as a result of medical issue, please seek a medical help, such as heart failure. Heart failure, poor pumping leads to fluid buildup. So if your heart is not pumping effectively, it will lead to fluid buildup. Kidney disease, the kidney filtered excess fluid from the body. So if your kidney is not working effectively, fluid and it's not removing fluid properly, this will lead to fluid buildup in your body. Okay, liver disease. Liver disease can also lead to fluid buildup in your body, such as mostly if you have low protein level. Low protein level causes swelling. Okay, so another another medical causes will be venous insufficiency. Okay, if you have a weak leg vein, if you have a weak leg vein, and one or most of the veins that carry blood to the heart it comes from the leg. That way you have your major arteries. Okay, so if you have a weak one, then there will be no much um, circulation of blood. So as a result, you end up have all this fluid buildup in your lower extremities. Blood clot. Certain medication like steroid or blood pressure medication can also retain fluid, therefore causing edema. So when edema is serious, seek doctor urgently. Seek medical help immediately. Okay? When edema is serious, seek medical help immediately. Get checked quickly if swelling is sudden and painful in one leg. So if you wake up in the morning and you notice a swelling in one of your leg, please seek medical attention immediately. Or you notice shortness, or you witness in a shortness of breath with chest pain, shortness of breath with chest pain, please seek medical help immediately. Mostly if you have severe worsening and unexplained pain, tightness in your chest pain, pain in the swallowing area associated with your kidney, heart, or liver problem, this is a medical emergency. Please seek help immediately. Okay, so let us talk about um what causes edema. So let's look about what causes edema. What are the real major causes of edema? Edema is the feet. Let's talk about what causes edema in the feet. So we're also going to look about in maybe a subsequent video. We're also going to look about what causes edema in your face, your abdominal area, and other part of your body. But for today, let us focus on the feet. So edema in the feet, swelling caused by fluid buildup. Okay, and can happen for a lot of reasons. Some Some are harmless and temporarily, others more serious. The key is figuring out what is causing that fluid to collect in your lower extremities. So why is this fluid building up in your feet? That is the key. That is the major reason. Here are the most common possible causes. Okay, we're talking about feet edema, swelling. The common word would be swelling in your lower extremities, swelling in your foot or ankle area. So if you are standing or sitting for too long, this this is one of the most common, but it's harmless. Okay, because of edema. Long hour on your feet will do what will cause edema. So sitting for long period, like during travel, you having a 8, 6, 8, 9, 12-hour flight, you might end up having this edema. If it is not medically connected, it will eventually go where you stretch, you get up, stretch, walk around, it will go. So sitting for long period like during traveling, like I said, will cause edema. So gravity pull fluid down into the feet. So sitting so long, gravity will pull the feet down to the bed. With these legs are elevated, it will eventually improve. Okay, so another possible cause of feet edema will be injury or inflammations. Swelling swelling in one foot is often due to strain or fracture. Bruising, tendon or ligament injury can also cause swelling in your feet. Insect bite can also be a possible cause, often caused with pain or redness if it is an insect bite. Another possible cause of feet edema would be poor blood circulation. It is also known as venous insufficiency because the major vein that carry blood to your heart and to the other part of the body actually come from your lower extremities. That when you have the major veins. Okay, so poor blood circulation can also cause fluid leaking into the tissue. Okay, when leg vein don't return blood properly, fluid leak into the tissue. Okay, the signs of this will be you see swelling worse at the end of the day, varicose vein. You see varicose vein, you see vein popping out in your lower extremities. You will see notice skin discoloration around the ankle. Okay, so another possible cause of feet edema would be heart problem, heart failure. Heart failure will also cause fluid to build up in your feet. Because if the heart is not pumping effectively, fluid pack up in the legs. Do not forget that the legs have a major vein that carry blood to the heart. So if your heart is not pumping effectively, your fluid will pack up in the leg. So the clue here will be swelling in both feet, both legs. You will be witnessing shortness of breath. You also witness fatigue. You'll be so tired. You will witness weight gain from fluid retention. This needs medical attention. Okay, kidney disease, kidney failure. Kidney help remove excess fluid. If they are not working well, if they are not working effectively, fluid will build up in the body. Okay, swelling may occur in feet, face, or hand if you have kidney disease or kidney failure. In other words, your kidney has inability to effectively filter the excess fluid. So this will cause swelling. Swelling may occur in your feet, if it is kidney problem. It may occur in your feet, and also it may occur in your hands. Okay, often leak with changes in your urination. If you're having a kidney failure, you will have some issue during urination. Please seek medical help. Liver problem can lower albumin, a protein that keeps fluid in blood vessel. So the main causes will be leg swelling, abdominal swelling, yellowing of skin or eye. Okay, so if you're having this medical issue, do not forget this does not constitute diagnosis or treatment. Okay, if you're having these symptoms, please seek medical help. Okay, so nephro damage can also cause fluid buildup in your lower extremity. Okay, when fluid build up, when nephro vessels are damaged or blocked, please kindly subscribe and share this video. Okay, kindly subscribe and share the video so that your loved one will gain from it. Okay, so the common feature with nephro uh, blockage or damage will be persistent swelling. Your skin will become tickling, often affect both leg. So nephro damage or nephro blockage can occur mostly after surgery. Nephro damage can also occur after cancer treatment, or infection can also be a contributing factor. Okay, so blood clot is another contributing factor that will cause feet edema. Okay, blood clot, also known as deep vein thrombosis (DVT), is a serious cause, usually in one leg. So the warning sign for this will be sudden swelling in one foot or one leg, pain or tenderness. It will be warm to touch, and also redness will be noted. Okay, this is an emergency because blood clot can travel to the lungs, and it can be fatal. Okay, pregnancy. Swelling is common due to increased blood volume. Pressure on leg vein is because the feet to swell during pregnancy period, but issues subside after delivery. But however, if sudden swelling with headache or high BP occur, this may signal preeclampsia, so you need medical attention. Okay, so another cause of possible feet swelling will be medication. Some drug causes fluid retention. This include calcium channel blocker like your blood pressure medicine. Steroid can also cause fluid retention. NSAID, such as ibuprofen, can also cause fluid retention. Hormonal medication can also cause fluid retention. Certain diabetic drug may also cause your feet to swell. Okay, so another possible cause of feet swelling will be excess sugar, excess salt intake. So excess salt intake will worsen exiting situation. Okay, so if you're already having a swollen leg, you're taking excess salt, it will worsen the situation. So because too much sodium makes the body hold onto water. Okay, so another possible cause again would be obesity. Because extra weight increases pressure on vein and nephro veins. okay, and nerve vessels, leading to swelling. Infection, foot or skin infection can cause swelling, especially in diabetes patients. So the possible sign here will be redness. Your skin, your lower extremity will be warm to touch, and also fever may occur because it's an infection. So pain may also occur. Okay, so when to seek medical help immediately. So we said that go to urgent care or ERO if swelling come with sudden swelling in one leg. It is not normal. Or you begin to have chest pain or shortness of breath. Please go to the ERO immediately. You have severe pain, redness, and warm to touch. Please, you become warm. Please seek medical help immediately. Swelling with fever, you need medical attention. Swelling plus heart plus kidney or liver symptoms, that we just make sure these are all medical attention. Okay, so let us look at some simple home remedy. Okay, some simple home remedy that we can use to alleviate mild and temporary edema. Please remember that this does not constitute diagnosis or treatment, but a simple home remedy may help ease mild and temporary edema. Okay, edema, which is swelling from the fluid buildup, usually in the feet, ankle, or leg, can feel heavy and uncomfortable. While some remedy would not replace medical care if there is an underlying causes. So home remedy may not constitute treatment. Okay, home remedy may not replace medical care if there is an underlying causes such as heart disease, kidney failure, liver problem. All these are medical, all these are underlying causes which home remedy will not be able to fix. So home remedy can definitely help ease mind swelling. Okay, so here are some simple safe home remedies that you can use. Number one would be elevate the swollen area, one of the easiest fits. Raise your leg above the heart level for 15 to 30 minutes. Do this 2 to 3 times daily. This helps fluid drilled back towards the heart. Excuse me. Okay, gentle movement and walking. Okay, because sitting or standing for too long will surely cause fluid buildup in your lower extremity. So standing, so gentle walking around, stretching, um, will help elevate the edema. Okay, sitting or standing too long makes swelling worse. So take a short walk, stretch your leg, do ankle cycle or calf stretches, because movement help pump fluid out of the leg. Okay, so then reduce your salt intake, because if you're already having a edema, you should please reduce your sodium intake, because too much sodium make the body hold onto water. So reduce your salt intake. Also avoid processed food, chips and canned soup, because These things are loaded with a lot of sodium for preservative. So you may want to minimize the amount of processed food you consume if you're already having edema in your lower extremities, because excess sugar, excess sodium would make the body hold onto water. Okay, so drink enough water. It sounds strange, right? Yeah, because but dehydration can make the body retain fluid. Do you know that? So aim for steady hydration throughout the day. Then you can also, don't forget, these are simple home remedy only for mild swelling and temporary swelling. Okay, this does not constitute treatment in any way. Okay, so this will help alleviate swelling in your lower extremities. So you can use the compression sauce if it is mild swelling, because this help prevent fluid buildup in the legs. Okay, best for swelling from standing or pregnancy or sitting for too long. But avoid it if you have a severe circulation problem, unless your medical doctor approve of it. Also eat sodium rich potassium rich food. I'm sorry to say. Also eat potassium rich food, because potassium help balance sodium and fluid level. So good choice would be your sweet potato, your banana, spinach, avocado. These are food that rich in potassium. So potassium help balance sodium and fluid level. You can also take some herbal tea, which are gentle diuretics, such as your ginger tea, your parsley tea, but use them moderately, especially if you are taking medications. Okay, you can also use a cold compress for localized swelling. Okay, so if one area is puffy or sore, you can also use cold compress. Apply a cold cloth for 10 to 15 minutes. This will help alleviate the swelling. To maintain a healthy weight, so losing 10 to 15 pounds will go a long way to help, because extra weight increases pressure on vein and worsen leg swelling. So take notice of that. So, but when edema is not a home remedy problem, then seek medical attention immediately. Okay, so remember that this does not constitute medical treatment. It's just a simple home remedy to help alleviate edema. Okay, so but when edema is not a home remedy problem, that is, in other words, the problem is not mild, it's not temporarily, then you should seek medical help immediately. If you notice swelling in one leg only with pain or redness, seek medical help immediately. You notice shortness of breath, or you having a chest pain, seek medical help immediately. Sudden or severe swelling, excuse me, seek medical help immediately. Swelling with heart, kidney, or liver disease, this is a medical emergency. Seek medical help immediately. Like I keep saying, that this does not constitute diagnosis or treatment. What we simply do in Get Well 101 is creating healthcare awareness. We teaches healthcare awareness. So we're giving you all these signs and symptoms that if you are noticing all this stuff in your body, you're having all these issues in your body, you should seek medical help immediately. And if you are living within our community here, we have free transportation for your doctor's appointment if you will not be able to afford one. Okay, because the essence of it is get checked out. Let's get to the bottom of it so that it can be treat so it can be better treated. Okay, so the earlier the earlier you are diagnosed, or the earlier the doctor knows of this, the easier the treatment will be. Okay, so this is Get Well 101. Thank you so much for joining. Okay, and uh, and we will see you again in the morning. Like I said, this will be the last time we're treating edema. Okay, so we will be talking about having a different topic, a very interesting topic coming up tomorrow, which will be focusing on kidney failure. What causes kidney failure? What are the simple home remedies that can help elevate kidney failure? Because you have hundreds, millions of people on dialysis. So how can we get to the bottom of it? Do not forget to join us tomorrow morning. This is Get Well 101. Thank you all for watching, and bye for now.